During this social media podcast, we will be discussing the vaccines currently offered by Florida Pharmacists. We are Group 19, and we are Ileana, Devin, Giovanna, Ryan, and Aaron. You may already know that vaccinations are a safe and effective way to prevent many common illnesses. But did you know that Florida pharmacists are now allowed to give certain vaccines to patients over the age of 18? Keep listening to find out about what vaccines are available at your local pharmacy and if you should get one. First is the flu vaccine. Influenza, or the flu, is a sickness caused by a virus. It can give you a fever, headache, body aches, a cough, and a runny or stuffy nose. For some people, they can get so sick that they need to go to the hospital. Although 90% of the people who die from the flu are elderly, meaning over 65 years old, young patients can also become infected and get very sick or spread the flu to others. Because of how easy it is to make you sick and how contagious it is, the CDC, also known as the Centers for Disease Control and Prevention, says that anyone 6 months or older should receive the flu vaccine. Pharmacists can give the flu vaccine to anyone over the age of 18 without the need to make an appointment with your doctor or pay a copay for an office visit. Private insurance companies, Medicare Part B, and some Medicaid plans will cover the flu vaccine at little to no cost to the patient. Contact your pharmacy or insurance provider to find out how much the flu shot will cost for you. There are many types of flu vaccines available in your local pharmacy. There is one vaccine that protects patients against 3 different strains of the virus. It can prevent you from getting the H1N1 virus, popularly known as the swine flu, and other types. Most adults should receive the standard flu shot, which uses a tiny needle for people that are needle shy, and also one that comes in an egg-free version. This is good for people who are allergic to eggs, as many types of the flu shot contain egg as an ingredient. These products are for people between 18 and 64 years old. For patients above 64 years old, you should get the high-dose vaccine. This type of vaccine is stronger, which older people might need in order to stay healthy. People who are at risk for getting very sick from the flu, such as women who are pregnant and people with lung or heart diseases, may also want the high-dose shot. A different type of vaccine protects patients against 4 different types of flu viruses, instead of the 3 we talked about. This vaccine is offered as a shot and as a nose spray that is approved for patients between 18 and 49 years old in the pharmacy. Next, we will talk about the shingles shot. Shingles is a condition where a painful rash can develop on the skin. It is caused by the same virus that causes chickenpox in children. The virus lives in your nerves and can flare up sometimes in the elderly. Everyone is at risk for getting shingles, but people over 60 years old often suffer from it most. For this reason, the CDC recommends that patients get the shingles vaccine once they turn 60. If you are 50 and older and your doctor thinks you are at high risk for shingles, you may also wish to receive the vaccine at the pharmacy. Getting the vaccine can protect you from a flare-up for up to 6 years. You should not receive the shingles shot if you are pregnant, have HIV or AIDS, or are on drugs affecting your immune system. Medicare Part D covers the shingles vaccine, but most people have to pay a copay. Medicaid may also cover the vaccine. Medicare Part B will not cover the shot, but you may be eligible to get it for free from the manufacturer if you cannot afford it. Ask your pharmacist or insurance provider for more information about the cost of the shingles shot. Another shot the pharmacy offers is a vaccine for pneumococcal pneumonia. This shot can protect you from certain types of pneumonia caused by bacteria. Pneumonia is a serious lung infection that can cause hospital visits and even death in the elderly. The CDC recommends all adults over the age of 65 to receive the pneumococcal vaccine to help protect them from this risk. The CDC also recommends this shot for people under 65 years old if they have sickle cell disease, HIV infection, asthma, or if they smoke. There are 2 types of pneumococcal vaccines, Prevnar 13 and Pneumovax. Prevnar 13 covers 13 different types of the bacteria and is recommended to be given in the pharmacy for people older than 65 years of age. Pneumovax covers 23 different types of the bacteria and is recommended for anyone younger than 65 years old with the health conditions we discussed before. Private insurance companies, Medicare Part B, and some Medicaid plans will cover the pneumococcal vaccine for little to no cost. Your insurance or pharmacist can tell you more. Starting early last year, pharmacists can now give the meningitis vaccine in the pharmacy. This life-saving shot is recommended for adults who meet certain criteria. If you are a college freshman living in a dorm, a military recruit, if you have a missing or damaged spleen, are more prone to infections, or if you are traveling to a country where meningitis is common, you should get the meningitis vaccine. If it has been a long time since you last got the vaccine, booster doses may also be a good idea. Speak to your doctor or pharmacist for more information. Because you are getting a shot, you should be aware of your rights under the law in the state of Florida. In the state of Florida, pharmacists can only give shots to people over the age of 18. If you are under 18 years old, you will need to see your doctor to get your vaccines. When you do come to the pharmacy to get a shot, you should be given a copy of the vaccine information statement made by the FDA. If you do not receive this paperwork, ask for it. You are entitled to a copy of this information for each shot you receive, even if you have received the shot before. This paper goes over a list of the things you should know about the shot, such as what it is for and if you will need a booster shot in the future. You are also allowed to get a copy of your vaccination history from the pharmacy who gave you the shot for up to 5 years after you get it. Ask your pharmacist how to get this information. So you've gotten your shot, and now you want to know what to expect for common side effects and what you can do at home. Although vaccinations are great in protecting the public from serious disease, they can also cause mild discomfort for some time after they are given. Most common side effects include fever, coughs or aches, fatigue, and pain where you got the shot. These problems are relatively rare, tend to be mild, and usually go away after 1 or 2 days. If you think you have a fever, use a thermometer to check. If your fever is over 100 degrees Fahrenheit, drink plenty of fluids. You can also try a fever-reducing medicine such as acetaminophen or ibuprofen. Ask your pharmacist if you have any questions about which medications to use. All vaccines should be closely monitored for unusual or severe problems. Your pharmacist knows how to handle an emergency if one happens while you're in their care. If you feel that you are having a severe reaction after getting a shot, including trouble breathing or swelling of the face, contact your doctor immediately or call 911. Today we have talked about the need for vaccines and who should get one. Vaccinations are a safe and effective way to protect you from many diseases. In order to make vaccines easy to get for people over 18, pharmacists are now able to give many vaccines in their pharmacies without an appointment. So go on and visit your local pharmacy and ask your pharmacist how you can start getting protected today. Thanks for listening.